the amount of virus that's able to spread in someone who has the infection, who had the vaccine and doesn't have the vaccine. I talked a lot about the mutations, and so the more times the virus has a chance to mutate, or the more times it replicates, the higher the amount of community spread that there is, the higher risk we are to develop a new mutant. So it's really important to protect our communities by sort of tamping down the amount of virus that's in the community and the amount of virus that's spreading within our community. And so this is directly applicable to your question, is how do we do that? Sort of full circle back to the beginning of my talk. In and of itself, the vaccine does not prevent the virus from you being exposed to it, from it sort of replicating in your nose, your mouth, your throat, that sort of thing. So even if you're vaccinated, that can still happen. What we have found is there have been a couple studies that show you still have a fair amount of virus that we can measure sort of the amount. But what we find is that people that are vaccinated, that you kind of get that original exposure, you sort of get inoculated with the virus, it starts to replicate, and then it, boom, shuts off really quickly. Your immune system takes over, it recognized it, it sort of shut that down. Folks who aren't vaccinated, even if it's asymptomatic, you're gonna get that sort of peak early after your initial exposure, and then sort of it just takes a little bit of time, 7 to 10 days, that's kind of where we got those numbers for quarantining. It takes about that long. And so how that affects us, our families, our communities, our churches, our places where we work, is we want the amount of time, the probability that you can spread it to others to be minimal. And so again, you're vaccinated, you can still be exposed, you can still have some bioreplication, but it gets shut down real quick. So it's possible, but again, a lot of the stuff we're talking about is how do you want to play the odds, right? Do you want to play the odds that you're going to expose your family, your community for days and days and days? Or, if you happen to be exposed that it's, a day or maybe 2 days. So yeah, it's a lot less. So you get vaccinated, you get exposed, the amount of virus that you would possibly spread to your friends, your families, your community is a lot less. Great question.